Hello and welcome to episode 14 of the LiveFitNow podcast. Today is a long conversation with GP Dr. Penny Ward. I can't wait for you to hear. We have covered so many different topics and we would love to have your feedback at the end. So without further ado, I'm going to leave you with our conversation. My guest today has been in the medical profession for 17 years. She works as an NHS GP and is training to be a life coach. She promotes lifestyle medicine with seminars, journalism, and takes pride in empowering clients to take responsibility for their own health and life choices. She has also just started her very own podcast in which she wants to strip medicine back to basics. Welcome to the LiveFitNow podcast, Dr. Penny Ward.
Hello, thanks for having me.
Oh, you're very welcome. I can't wait to talk to you today. I can see we're going to have lots of fascinating things to discuss. And I guess I'd really like to start by just, what is your job? What is your job to you and why did you choose to do it?
Oh, that's a tricky one. So the answers have evolved, I guess, through the years. So my title is a GP, a general practitioner, and that is my day job, I would say. That's the bread and butter. I want to say 9 to 5, but it's not 9 to 5. So in that role, I see everything. Really is the cradle to the grave. You know, you follow families, you get to know the relationships between different family members, and they trust you and come to you with different problems, whether they be medical, social, you know, they just come and open up. But I suppose there are lots of other little sidelines going on. I have a huge interest in journalism and the media. And probably for about 10 years, I've been writing in magazines, newspapers, adding commentary. And recently I've been doing some TV work on BBC South Today, primarily giving commentary on what we do. And then I've got my podcast as well. So yeah, there are loads of little pies that I've got my finger in.
And what drew you to become a GP in the first place?
Do you know, I never wanted to be a GP. And I know that sounds strange, but from probably the age of 7 or 8, I wanted to be a paediatrician. My sister was diagnosed with type 1 diabetes in the 1980s, and I spent quite a lot of my childhood in and out of a children's ward. And I wanted to be that figure in the white coat who was going around trying to help people. And that's where I was, that's where I went. I became a trainee in paediatrics, and then I started my own family and realised I couldn't have such a niche and be able to help my mum, my dad, my sister, my uncle, my cousin, knowing only about children. So that's where the GP side came in.
Wow, that's interesting. And it's so often the case, you know, the people I talk to, there always seems to be that pivotal moment. There's something that sparks the interest as to why you go down a route. And I guess for you, it was your sister's diagnosis. So that was sort of your pathway towards helping others.
Absolutely. And there are no doctors or medical professionals in my family, so it seemed like I was a bit of an outlier, saying I want to be a doctor, I want to be a paediatrician, but that was my goal for as long as I can remember.
And what has drawn you down the pathway, you know, towards journalism and writing? Is that because you wanted to be able to expand your reach, or is it just sort of an itch you wanted to scratch that you couldn't do whilst being a GP?
There are a couple of reasons, and the first one is I love writing. So I guess my way of relaxing and my stress busting is to put it all down on paper and to write, and I absolutely love it. So it doesn't feel like a chore. But also I feel like doctors are often misrepresented, and a lot of people think that we're quite cold, perhaps, or we don't explain things properly, or we'll give you this whole dialogue that you can't understand. And I thought, actually, if we want to be responsible for our own health and, you know, look after ourselves properly, we need to actually understand what's going on in the first place.
I think of all medicine, being a GP from an outsider's perspective seems to be one of the hardest jobs, because you're expected to know about everything, and it's impossible to know about everything. I'm sure you've all got your own sort of specialties and areas that you have more interest in, but people are basically walking into you with a few minutes of time to tell you all their problems, and then you try and get an answer. And I guess that's an incredibly challenging thing from your perspective. And is time one of the biggest problems that you have?
Yeah, it can be. And I think one of the frustrations from my point of view is that you only get 10 minutes in a single appointment. And as much as we say to people, we love you only to come in with one problem, so many things are intertwined and meshed. And if you've waited 6 to 8 weeks to see your GP, of course, you're going to talk about everything you possibly can, because you're not going to get to see someone again.
Absolutely. And it does make sense. And I guess it's interesting from my perspective as well, because I get the impression that there's a far bigger move now towards lifestyle medicine and actually empowering the individuals to take different choices within their lives that therefore take less intervention from medicine. Do you think that's true, or is it still quite a divide within the GP community?
There's still quite a divide, I think. I think some people are still very much, this is the diagnosis and this is the management, rather than is the diagnosis one that can be reversed if we make better and healthier lifestyle choices and decisions. So there's a huge divide, and I'm kind of hoping preventative lifestyle medicine will come into things more as the next generation qualifies, but at the moment there's a huge divide.
And that's exactly what, this is what this podcast is about for me. I think we all just need to have that knowledge so that we can make different choices. And was there a particular stage that you moved towards lifestyle medicine, or was in fact it always part of your ethos?
I don't think it was always part of my ethos, but I'm not sure I can put my finger on when it happened. I think it naturally progressed as I was talking to patients and realising that they were making decisions that didn't serve them well, or they were developing diabetes very young, and you only had to look at their lifestyle to realise that they could potentially reverse it. So I think it evolved, I guess, with my career progressing and being able to pick out telltale signs.
And do you think it is something that's starting to grow now within your surgery, within the wider community? Is there more openness to it, or again, is it just one of those split things?
I would love the answer to be yes to what you've just asked, but I'm not sure everybody's that open to it. I think there are so many guidelines, and in that 10-minute period when you've got a patient in front of you, if you've got guidelines that should tell you how to manage, say, the diabetes or the high blood pressure, and then somebody mentions a bad knee or a skin condition, it's very, very hard, I think, for people to then be able to say, what, the knee and the skin condition can potentially wait. Let's just stick with the high blood pressure, the diabetes, and try and really nail that in the one sitting. So, yeah, I'm not sure everybody's that open to it at the moment.
I guess with everything, it takes time, doesn't it? It's changing potentially a lifetime of thinking that X, Y, and Z is how you get to the end, but it's not necessarily as simple as that. It's a little bit more complicated, and as you say, we haven't necessarily got the time to go through it. Have you found there are any particular lifestyle changes that you suggest to people that have the biggest impact?
I think diet more than anything. If you have time to really get down to the nitty-gritty of what people are eating, then there are huge changes that can be made. But I think, I'm not sure the population as a whole, when they come to see the doctor, are willing to accept lifestyle choices either. If they come, and they've always had a fairly rigid management plan from their doctor, and they come expecting that magic pill and that magic treatment, they're not always that happy when you tell them, if you cut out X, Y, and Z, that will make the biggest difference.
I think it's that human condition of everyone wanting the magic answer.
Absolutely. In one go.
Yes, absolutely. And most things just take time, consistency and persistence, and that's a much harder sell than just giving someone a prescription.
It is. Yeah, absolutely. Take this one a day and you'll see an improvement in 2 weeks. Yeah. And it takes no effort from anybody to take that tablet.
Absolutely. The biggest challenge with, habit change is the fact that it does take effort, and you have to readjust your life in ways that perhaps you didn't necessarily want to in order to make those changes. And often it can involve a little bit of discomfort. And again, naturally, we try and avoid discomfort as much as possible.
Yeah.
So outside nutrition, what other ways do you think are the best ways of taking better care of our overall health?
There are so many out there, and I think it's hard to pick a few, but exercise has to be next, I think, in my, if I'm ranking them, it'd be nutrition, then exercise, and then probably sleep, and next would be, you know, addressing your own stress levels, mindfulness, and that side of things. But they're all sort of intertwined, aren't they, depending on the individual?
Absolutely. And it's finding, I guess, the pillar that's most important to you right now as well, isn't it? Because sometimes you need to focus on one in order to have a better knock-on effect to all the others. I think sleep, as you just mentioned, in fact, I've just had an episode come out on sleep, and you can see that if sleep goes wrong, quite often all the other bits go wrong as well, because if you're tired, you get more hungry, all those other decisions actually change. So you're absolutely right. It's almost a sphere, isn't it, than anything else. Do you think there are any common myths linked to your field that you would like to debunk?
I think the biggest one is that GPs don't listen. I know I say that I like working with the media and doing a lot to do with the media, but at the same time, media is always doctor bashing, and it's always GPs that get it in the neck. And I suspect it's because we're the front line of, you know, everybody's first person or, you know, first contact they have with health professionals, unless it is an emergency. So I would like to debunk that we do listen, but we might only be listening to one of the things you're saying. If you're throwing, you know, if you're telling us a sentence that has potentially 7 problems in them, what we perceive as the most urgent of those 7 problems might not be yours. So you might not think we're listening because we've chosen what's urgent to us and not urgent to you.
Of course, you've got your own priorities that you need to make sure that you're looking at first. And do you think perhaps a problem could be that people come to you for things that are not necessarily you as the best person to come to? Do you think there are other areas that might solve issues before coming to the doctor? Or do people generally come for pain? You know, what is the most common reason people come to you?
I like how you phrased that. So yes is the answer. People come to see the GP for things that they don't necessarily need to come and see us for. There are a lot of other provisions out there. They could go to the chemist, seek help with rashes, with acne, with hay fever, with conjunctivitis, with diarrhea, insect bite, you know, so many different minor ailments shouldn't touch the doctors before somebody has tried to help themselves first. And I think whilst we're in the middle of the COVID pandemic and we're in lockdown, certainly at the beginning when everybody was terrified to come out or to seek help, a lot of people are actually self-managing their conditions a lot better than I've seen in years. We're now getting people coming back saying, I've got, for example, awful shoulder pain, and you ask them what painkillers they've tried. Nothing, absolutely nothing. Or they think they might have got worms, but they've not gone to get some medicine for that themselves.
Interesting. And it's true. I think I had an optometrist on here a few weeks ago, and she said exactly that, in as far as there are things that people should be going to her for. If you've got a problem with your eyes, she is the perfect person to go to because she is a specialist in eyes. So she can quite quickly solve eye-related problems, whereas a GP, of course, you have knowledge on that area, but there's nowhere near as in-depth as she's got, because she studied it for years. Just, you know, I'm not sure what it is. Do you think it's education for the general public? Do you think maybe we need to get a better understanding actually as to which professional is the right person to go to for the different problems, just to be able to kind of spread the load, so that actually potentially, who knows, I'm not sure if our population is too large now, but then you could have more time with the people that really do need to be coming to you, and then you can spend more time with them and working through those issues.
I don't know what the answer is. I'm not even sure if it is education, purely because there are lots of sources out there already on all the NHS websites listing in red, amber and green. If you've got this, you self-manage. If you've got this, you see your GP. If you've got this, you go to A&E. And that's been out for years, but people aren't really following that despite it being everywhere. So I honestly don't know what the answer is. People talk about, should people have to pay a small amount to come and see a health professional? But then the worry is, what happens if people can't afford it, or you've got the elderly patients who desperately need to see someone, but they're having to choose between the next meal and whether they seek medical care. So that's not a great solution either.
It's a tricky one, isn't it? Again, I guess it comes down to a sort of quite a deep-rooted societal change that if it happens, it would happen over time rather than, as you say, just putting an education announcement out, telling everyone what they should be doing, and then they'll soon forget when it actually comes round to them having the thing that could take them somewhere else. It's a tricky one. Do you think, you mentioned sort of this time of lockdown, obviously your job has changed within that time because you're not seeing as many patients face to face. Do you think that is something that will carry on moving forward? Do you think there is an evolution that will potentially stick within your industry?
I hope so. I think there are quite a lot of positives that have come out of different ways of working during COVID, and one of them for me is the ability to do telephone calls. I've had symptoms myself, but I've been able to stay at home on lockdown, self-isolating, but also carry on making phone calls to patients. And I wouldn't have done that otherwise. But also people who are working, they don't want to have to take a morning off to come and see the doctor who might be running potentially an hour late, to then not be able to even fit in all of the problems that they wanted to talk about. So I think telephone first certainly has a role, not for everybody, but I think it's probably going to be here to stay.
That sounds really good. And it's almost one of those things, I guess, that can save a lot of time for, if there's such a thing, like relatively straightforward cases that are very simple things that you can just put straight through to a telephone consultation rather than in person. And the people that really need to have that face-to-face time and that interaction, and you to be able to touch them or whatever it might take to give the diagnosis. Again, in theory, perhaps you can get more time back for that, which I guess is sometimes a forced change can lead to a better system.
I think this will lead to a better system. The NHS has been struggling to the point, probably 6 months ago, I actually thought GPs and primary care would all become privatised because we were crippled by recruitment problems and funding. And I think this is probably what we've needed as a springboard to actually get services back on track. We haven't got the red tape from the government. We've got a almost free leash to change services how we see it rather than being imposed on us. And I actually think it's going to be for the better.
Sometimes all you need is to be able to show the proof, and if you're getting the opportunity to do it, there will be no reason to change it then. Yeah. It sounds like at a high stress and very difficult time, it could end up being a very good thing for the NHS in the long term.
I hope so. I just hope people aren't quick to revert to their old ways and actually forget everything that's happened in this 6 months, because we were here before COVID, we'll be here after COVID. We haven't changed. The government's perception of us has changed.
And do you think there are any general issues, or perhaps this has changed actually because of the time we're going through? Like what do you think the biggest issue is for the NHS?
Recruitment at the moment. I think a lot of people, certainly if I'm thinking of GPs and primary care, they would much rather locum, so they can choose the days, the hours, the shifts they work, how many patients they see, whether they do admin, whether they do house visits, and they can dictate the price they want to be paid. And they're not then having to put their roots down in a practice and create a stable environment for us to be able to carry on providing services. So a lot of practices are closing down just because they can't get GPs to work there. Same with nurses, doctors on a lot of training schemes in the hospital. At the moment, I think the biggest problem is going to be making sure we've got enough doctors, nurses, healthcare assistants moving forward.
That seems really concerning actually, and also I think from my perspective, something that's special about, or can be special for a lot of people about a GP, is that you actually have a relationship with them. There is a personal element to it, and the fact you get to know somebody. And I think it's much easier for someone to share, the potentially embarrassment or just things that they haven't talked about anyone else in the world about, but they feel like you're the right person. And if they haven't got that relationship, I wonder if that is a really tricky thing to deal with, because you can build a real relationship of trust.
I think people who aren't putting their roots down and having that continuity as a doctor for the patient, it works both ways. But I love seeing families and people back. And also when I see them, if I know them, I can just look at them and I know that something's wrong because I've looked after them for so long that it's just a simple look if somebody's well, if they're upset, if they're stressed. And I don't think I could work not having that sort of continuity.
Do you think it makes you a better GP? Do you think it's difficult to be the best GP you can if you have no sort of relationship with at least some of your patients? Because of course some people only pop in every couple of years or whatever, but to actually have that regular contact and even just checking in with people because they have that connection with you, rather than waiting 10 years until you're really unwell and you force yourself to go to the GP rather than actually, if you'd gone a few years back for an MOT, so to speak, you could have prevented something or caught something earlier on.
I think it makes you a better GP because I've never been a locum, so I don't know the locum mindset, but I kind of think if you go into a surgery and you've got 16 patients to see, and you know that you're never going to see them again, you're never going to be the one chasing up their blood test or investigation results. Do you either over-investigate or over-treat, or do you just try and firefight for that simple thing in front of you rather than digging deeper to see what's behind it? So I worry that probably, if you go and see a locum because you've got a chest infection, a wee infection, you don't need anything other than antibiotics, and that's easy. But if there's something else going on, it's really hard, really hard.
Yeah, absolutely. And I guess, when you're thinking from a broader sense of lifestyle, and so often things like stress and trauma can be the underlying problem. So the symptoms that they're coming to you about, as much as obviously that's the thing that they're hoping to get some result from, fundamentally, if they are inflamed, if their bodies are inflamed, it's trying to get to the root of that, and that takes time. And again, I guess you can see that in people. Is that the thing that gets you most excited about being a GP?
I think it's the relationships as much as the medicine. So having that personal touch. And I always say to every patient that I'm treating them as I would a family member, that I'm not treating them as a number. I'm not necessarily going to follow the guidelines. I'm just going to treat them in their very best interests. And that might be deviating from, the path that they might expect or the guidelines they expect. But that's what I'd want for my mum. So that's what I expect to do for them.
Do you find it tricky to convince, I'm not sure that's the right word, but to show people a different way? Because obviously, as you say, a lot of people have this kind of clockwork idea that if there are certain issues, you're going to get certain medication, and they have their expectation, but it's not necessarily the best route. Do you come across a lot of obstacles with that, or once you talk it through to them, are most people open to giving these things a try?
I'd say about 80% of people are open. If you've done your job well enough in setting up the cell, so you've asked them the questions, you've made them see actually what they're saying and what potentially the cause might be, they'll often be the one who'll say, oh, actually, if I change this, do you think it would help? So it's sowing the seed that other 20%, not only are they resistant, sometimes they're quite angry and don't really like it at all. They just want you to give antibiotics or sleeping tablets or something, and yeah, it can get quite heated.
Yeah, it's difficult, isn't it? And this is obviously a difficult question because I'm sure you see so many different people, but do you find that you prescribe less medicine now than you used to in your early days?
I probably prescribe different medication than I used to. Less, probably I do. I certainly stop a lot of tablets. So when I came into the practice I'm in 6 years ago and I inherited a list of patients, I've certainly stopped a lot of medication they've been on for years, and I love taking things off people's repeat prescriptions. But yeah, I think I probably do. I think most patients who know me well know that I'm not a fan of tablets, and I will only give them if there's nothing else that can do its job in its place.
That's great. And I guess some people that aren't willing to change, you kind of have no choice. It's like either they're going to go down the medication route, or they're going to do nothing to help themselves. So I guess that's always going to be a small percentage, but I think most people, particularly if they're not feeling particularly well, are open to at least giving something a try. And I think with a lot of things, because I was on medication for a number of years for IBD, and I'm now completely off everything, but it took time. And I think it takes time to really listen to your body and be aware of the telltale signs and the symptoms. And our bodies tell us so much all the time that I think many of us will just completely ignore, when actually if we start paying a little bit more attention as to how we're feeling related to certain things, from movement and food that we eat and various other ailments that we might get, it can completely shift that need for medicine as well. I think perhaps we've just become a little bit closed off to how we're feeling.
I think so. And I think, again, it comes down to, is it just simply education to change people's mindsets? A lot of people really aren't in tune with their body, and they don't necessarily put, for example, if you're eating gluten, they don't make the connection gluten between their bloating. They think potentially that might be ovarian cancer, which it might, but that's their first route they go down. They don't even give it a second thought that it might be dietary, or it might be alcohol related, or, you know, loads of different things could be influencing it. And if people started to listen to their body and the things they're doing to their body, they might find some answers themselves.
I couldn't agree with you more. It's amazing really how much power we have, but potentially let go of by not listening to our own bodies, and just realizing that actually there's a lot of changes we can make without it being overly dramatic or traumatic.
Yeah, and a lot of people say, the ones who come back and say, I've made the dietary changes, I've increased my exercise. I'm thinking of one lady in particular. She came back with her daughter bouncing into the room and said, look at me, look at the changes I've made. I'm off my tablets, so it was blood pressure tablets, HRT, and, you know, she just looked and felt fantastic. So it's nice when people sometimes come back and say, I was a bit hesitant, I wasn't quite sure about the route you were sending me down, but it's amazing.
Oh, that must be amazing to get that feedback. And actually, interestingly, you sort of mentioned a couple of medicines there. Do you think there's a top 3 medications that lots of people take that are most easily removed if the appropriate action was taken, and of course being advised by your GP to do so?
Antidepressants, painkillers. I think it's very easy to mistake genuine. Reason I would choose antidepressant, I think a lot of people come and see doctors feeling sluggish, feeling like they're lacking motivation, they've got no energy, their sleep's poor, they're quite tearful, and they think they've got depression, whereas actually it is lifestyle changes, or it's social situations, it's life circumstances. And I think you can easily go down the rabbit hole of depression, rather than actually thinking if you put anybody in that situation, in that person's shoes, they'd feel identical, in which case it's not depression. And then obviously pain is hugely related to moods. A lot of people would prefer to take painkillers and mask the pain rather than try to address why the pain is actually happening. Have they got an arthritic knee because they need to lose weight, or they need to be more mobile? Are they taking painkillers and actually they're not having any benefit than helping them sleep at night? So there are a lot of different things that can be done for pain. And blood pressure tablets, yes, a lot of people need blood pressure tablets, and they need them not just for blood pressure, but because they've had a heart attack or a stroke, and they actually need them to try and prevent anything else from happening. But some people take blood pressure tablets because they don't eat very well, they have too much salt in their diet, they're particularly stressed, they don't sleep, and they're overweight. So lifestyle changes. I
can see that, and you can see the sort of common link between the type of medication that you can come off, because there are actually lots of areas of our lives that we can improve in order to not need them. And when it comes to painkillers, do you think there's a problem with the painkillers that we can just buy over the counter, not just the ones that we can get prescriptions from our GPs? Do you think there's a problem across the board that people are just taking them for too long and too many of them?
I think we're quite lucky in the UK. You can't really get very decent painkillers over the counter. So people will maybe take a lot of paracetamol or a lot of ibuprofen for headaches, and you can get medication overuse headaches if you're taking them for longer than 15 days every month. So you can potentially exacerbate and drive a problem. But I don't think over-the-counter ones are too bad in this country, actually.
And I guess, again, actually coming back to one of our earlier discussions, it's one of those things that it's finding the cause of the pain. You know, if it's internal, you probably are absolutely the best person to go to. But if it's muscular pain, there are many different avenues to go down, I guess, to improve your situation, from performing exercise, you know, doing resistance training. I've worked with a lot of people that have had a lot of back issues and a lot of back pain in the past, that approaching it in the right way, carefully building the foundation and strengthening that back up, they barely, if ever, get any issues with their back anymore. So there are things that you can take control of that could potentially go on for years if you do nothing about. So you just have to keep taking the painkillers, or you could make some changes to your body and life and potentially not get any issues at all. And I guess it's, again, that awareness, and I'm not sure how best the general public will feel that message, because pain, I guess, often encourages people to not want to do anything because they don't want to risk the pain getting worse. But there are many different avenues to go down, from physios to osteopaths to coaches that can teach you how to get your body stronger. There's lots of different routes to go down depending on what the issue is. But if you don't try and figure out what the root cause is, you don't know whether you can solve the problem.
Absolutely. And I think you've hit the nail on the head, that there are so many things, regardless of the symptoms, that actually we're responsible for ourselves. And there are a lot of avenues that you can explore using the internet, using various, you can get lots of PDFs from physiotherapists on the internet. You can self-refer to physiotherapy. There are so many different avenues that people can go down before coming to see the GP. And my favourite patient is somebody who sits in front of me and says, if you're using back pain, for example, I've had back pain for 3 months, I've self-referred to physiotherapy, I've had these treatments, I've done resistance training, I've seen a chiropractor, I'm at a loss what to do, how can you best help me? And I love the patient who tries to help themselves first and comes at least trying to have had a solution before turning up on our doorstep.
That's great. And it's nice to hear that it is a good thing, on one hand, to try and help ourselves, just as long as we don't turn to Google and read that we could possibly have 10 different types of cancer. That's probably, I guess that's the flip side of the internet, isn't it? You can go one way and figure out ways to help yourself and see if you've solved the problem, or you can go down the other dark rabbit hole into convincing yourself you've got 10 diseases and you must go to the doctor straight away, or you're gonna, you know, you've got 6 months left to live. There's two great extremes, but if you go down one way, I guess it saves you so much time.
It does. And I suppose, coming to that point, NHS has got loads of resources online and a website that's full of different links. So if you Google back pain, there will be links to PDFs for physiotherapy exercises on there. You don't have to put directly into Google back pain exercises and see that you might have, you know, an osteosarcoma or bone metastases as the first thing, because that's what Google does. It will pull out all of those messages and all of those forums that people only post on when they've got something, you know, that hasn't gone so well, and put the diagnoses in that order. But NHS websites, definitely.
Do you see yourself always being a GP, or do you have visions for the future that take you down a different path?
I don't know. I think part of me is always going to want to be a GP for some of my working week, purely because I can see that I am doing good. Maybe not to everybody, but I think I am making some degree of difference to some of the patients. But I don't see myself doing it 100% of the time forever. I think there's a huge part of me and a huge passion inside of me to try and educate the public and try and go down different routes with people. And whilst I'm not sure how to do that, I've been trying for years, and I think there's a big part of me that still wants to push that, and I need to give that some time.
That makes complete sense. And it's trying to figure out the best way of reaching people. And I think it brings me to the question, is that what inspired you to start your own podcast?
That's exactly, 100% what inspired me to start my own podcast. frustration as much as anything, that I feel we're not allowing patients to identify what might be happening with their body, because we're not empowering people or giving them the knowledge or the skills to identify what could potentially be a danger sign or a red flag. And I think until we make people aware of what are the bad things to look out for, it's quite hard to say you can ignore X, Y, and Z and try and treat it yourself. So I think there's a huge amount of work that needs to be done to make sure that we're doing everything safely.
It's a fine line, isn't it? Because, you know, I can see that we have very similar goals, I think, from our podcasts, because you want to empower people and give people the knowledge that actually there's a lot of things you can do for yourself, but at the same point you don't want the people to take it so far that then they're not coming to you when they actually do need to. There's a limit to where you can do everything perfectly, but there's still an issue, and it's still being able to push through that and empowering and having open conversation. I think that's really important. I think there's probably still a lot of taboo areas within medicine and just our own general well-being, that there are certain elements that are talked about a lot and there are other things that aren't. And I guess you can see it within even the research. There's a lot of research in certain areas and a lot less in others, and it's figuring out the best way of communicating with the most people.
Yeah, and I think that's where the problem's lying at the moment, that red tape area. When do you cross that threshold of what's safe for you to do? And actually when you've potentially missed something like a cancer diagnosis and you should have sought help sooner. So it's a double-edged sword, I think, and it's trying to make sure that we make the messages clear but safe. And that's what I'd love to focus on in the next few years. It's just trying to figure out the best way how to do that.
Yeah, and it's difficult to, from your perspective, you have such a short amount of time and you're trying to pick up on all the appropriate effects, you know, the symptoms rather that people are experiencing, and then make the right decision as to where to go, whether you do need to refer them to a specialist or whether in fact perhaps they're just a little bit stressed and it's not really too much of an issue, and if they make a few tweaks then they'll be absolutely fine. And that's also a fine line as to how much pain someone's experiencing, because what one person might come in and tell you, you know, it's 10 out of 10 pain, someone else might just say, oh, it's a 2 or 3, and the perspective of pain is so difficult. And that's something I guess you've probably learned over your 17 years, that you get to read people and you can see the pain within someone.
Yeah, like you say, it's hugely subjective, but if someone walks in saying they've got the worst back pain of their life and then can hop up on the sofa without wincing, you get a fairly clear idea that their 10 out of 10 back pain probably isn't the same as mine. And again, it comes back to the continuity of care. You can tell by looking at somebody's face if they're in an awful lot of pain, and if you recognise and know that person well, then the minute you look at them, you know what's going on.
What have you found to be your biggest challenge in your career so far?
Oh, that's a good one. I think it has to be the public perception and expectation. Huge changes in expectation across the years I've been a doctor, and I think it comes back to the earlier conversation, people come in and their expectation is, we have given time to come and see you as a doctor with our problem, and we expect you to make that better, or we expect you to give us an answer, or we expect you to give us a plan and put us on the trajectory that is going to improve things. And sometimes you can't. Sometimes it does either lie within lifestyle medicine and the patient actually has to take some responsibility in making the right steps themselves, or as they're perceiving their illness, it's very different to yours as a doctor, and it's trying to find a joint mindset. But I find sometimes patients' expectations are very, very hard to manage, and that can break down your relationship with a patient if they've got one expectation compared to yours, or you're trying to deliver a message that you're doing with their very best interests at heart, and they're becoming argumentative or defensive or reluctant to listen. So I think expectation's the big one.
Yeah, I can see that. It does make sense. And it's interesting. It kind of got me thinking whilst you were saying that. And obviously there are lots of different types of GP. There's perhaps the more old-fashioned, less open to lifestyle, very much medicine focused, and then nearer to your end of the scale where you are much more lifestyle and open-minded and see the many different aspects that play a part, and obviously everything in between. And I remember once I went to it was an emergency GP appointment because I wasn't very well, and I sat down and she said to me, "What do you want me to do?" And I just thought, well, that's why that's kind of why I've come to you. If I knew what I was to do, I happened to have like a really sore throat and I could barely swallow. That was the thing. I have no idea. That's why I would hopefully like your help. So that's one end of the scale. And obviously at the other end, you would have someone that would talk through what your problems are rather than asking what you want to do. And do you think it would be useful in some ways to have different kinds of GP services? Because I guess people have different expectations, as you say, and I think there's a lot more people like myself now who want a more holistic and lifestyle-based approach and wants to speak to doctors like that, knowing that they're not going to immediately want to just put you on medication. They want you to get better in a particular type of way. And then obviously there are more traditional, we'll say traditional, but I'm sure it's more complicated than that, people that will be more warmed towards the medicine route, of which some people would much prefer to. Do you think it would be easier in some ways if you had different GP practices that had its particular ethos that would therefore get the right sort of patient to the right kind of GPs? Or do you think it's better to have a mixture?
I think probably within one surgery, so under one roof, it's better to have the mixture. So then patients can pick and choose, and patients, everybody's fickle. So, they might go down one route and actually think, you know what, that isn't working. I don't think I want to do that anymore. I just want to go and see Dr. X and get that tablet to try. And at least they've got the chance to do that and to swap and change or mix the two. They might want to go down a more lifestyle route alongside trying traditional medicines that they hope to wean off as the lifestyle improves. So I guess everything under one roof would be perfect in my ideal surgery setup.
Yeah, I can see that. It gives people the choice then, doesn't it? And I guess also it allows you to influence each other, because we all never stop learning. And I suppose if you only surrounded yourself with people on the same page, in some ways you'd learn less. You get to see people's perspectives if they have differing views.
Yeah, and we all, where I work, we all discuss patients, and different people will take different patients and scenarios to different doctors depending on the advice that they want. But I think as a GP, it's probably important not to be too insular in your thinking and actually be open to the whole range of tests, investigations and treatment you can offer.
Yeah. Are there any particular areas that you do specialise in, or are you purely general?
On paper, purely general. Absolutely anybody can walk in and I'll see them. My areas that I particularly love doing are still paediatrics. I love gynecology, family planning, and all of that side of things. So I've still stuck to the areas that I like, and I think that I'll probably see more gynecological and paediatric cases within the surgery, but I quite like seeing the mix as well. So not specialist, but that's my preference.
Sometimes it's just about who you can communicate best with, isn't it? Because as a mother, obviously you can appreciate certain aspects that certain people are facing, whereas someone who's never experienced that, as much as you can have a broad idea, I think that ability to communicate just becomes that much stronger once you've been through something yourself.
I think adding a personal touch and a personal angle, and I will try to use that with patients. For example, my dad had a series of heart attacks in his 50s, so if I see men of a similar age or women of a similar age, I will tell them about my dad, and he's fine now. He's still playing cricket at 70, although he's got creaky knees, but I will tell them and say, this is what's happened and this is how he managed, or this is how it affected his emotional confidence after that. And I think having anecdotal stories just makes you more human.
It's true. It makes you more relatable, doesn't it? And how important is prioritizing lifestyle to you? Because I can only imagine it's difficult to fit it all in when you have such a busy life, but is it something that you choose to prioritize?
In a perfect world, yes, I would. And coming into lockdown, I had all these great hopes of, going on long runs and coming out the other side fitter and healthier. And I have to say, my daughter's taken up baking, so actually my lifestyle priorities haven't quite gone to plan. But yeah, I do try and eat healthily and teach the kids about lifestyle choices that they make and how it will affect them, and encourage exercise. So it's definitely up there with my priorities, but not to the exclusion of everything else.
Balance, all about balance.
Yeah, all about balance.
Do you have ambitions to write a book?
I'd love to write a book, yes. yeah, I would absolutely love to write a book. And I often think about it and think, would it be a series of my blog posts, a lot of which I've taken down and don't post anymore because they're so old, or would it just be starting again from the beginning? But yeah, that would be an absolute dream of mine.
See it all coming together. It's just figuring out all the different routes of getting to people, isn't it? And how you can just help them in some little way with your wisdom and knowledge.
Yeah, I was trying to figure it out.
Yeah, absolutely. And how to put it all into one book. Do you have any general tips or advice that you think would help the general public?
I think my key message, and I mention this quite a lot in my podcast as well, is that you actually have to know what's normal for your body. And that comes back to what you were saying. You have to be in tune with every single part of your body to be able to know when something has gone wrong or when something isn't normal for you. So I think my biggest message would be just be in tune, listen to your body and know what's normal for you. Try and figure it out yourselves a little bit. And if you can work out where it's gone wrong, put in some basic steps to try and help yourself. But I'd say only try that for a maximum of 4 weeks. And if that doesn't help, then maybe you should get a second opinion just to make sure you're not missing anything big.
Brilliant. That does very much make sense. And it is absolutely, I think, about becoming in touch with ourselves, but also I think being open to change. I think quite often people have ideas about all of these things, like they've been on diets and they didn't like it, and they've been to the gym and they don't like that, and there are things they've tried that didn't work for them. But that's not to say there's not something out there that does work. And I think sometimes those preconceived and self-imposed limitations on an idea of something is the thing that can stop change happening. And I think, from my perspective, I think exercise is very often that is a problem, because I didn't particularly enjoy sport at school. It wasn't really my background at all, other than swimming. Didn't really like it. But now my whole career has turned into something because I tried something new that I didn't know I was going to like, fell in love with it, and changed the whole path of my career. And I think that applies with any sort of exercise, and in fact just movement. I think we need to realize that our bodies are made to move and not sit, but it doesn't necessarily have to be the same movement that Joe Bloggs next door likes. It's about finding what you enjoy. You might just love going for long walks. You might enjoy going to the gym. You might enjoy a home workout. You might want to go horse riding, go for a round of golf, whatever it might be that works for you. But it's all about trying new things to find the thing that works for you. And I think that's when we become more in tune with ourselves, when we realize we get either enjoyment from doing the thing or the repercussions of it. Because sometimes during exercise, the actual moment of exercise isn't always the most fun, but the repercussions afterwards, when you're feeling stronger or fitter, or you get that buzz afterwards, that's the plus from it. But I think it applies for all aspects of our lifestyle, really. And I guess if we can be open-minded to try something that we haven't tried before, you might just find the thing that's just right for you.
Yeah, and I think, like you say, change is scary, and it's almost getting into the mindset of change first and setting yourself what you seem or perceive for manageable and small goals to start with, and just trying to reach that first manageable goal and see how you feel. There's a girl, and I know she won't mind me mentioning this, who works with us, who last New Year I posted a plan to everybody in the surgery, and I said, we're going to do HIIT training in the waiting room at lunchtime, we're going to go for a run on a Friday, and everyone needs to sign up to donate blood. So that was my message to the surgery. And this one girl, she said, I'm not running, I'll do anything, but I'm not running. And during lockdown, she started the Couch to 5K. And every week she said to me, so one week she said, I've got to run for 5 minutes, I don't think I can do it. And now she's running for about half an hour, 3 times a week, and keeps making me try and feel her muscles that she says she's never had before. And she's the happiest I have ever seen her. But her direct response was, I'm not running. And that was a couple of years ago. So I guess it's just, don't dismiss anything. You know, there is something, like you say, for everybody, isn't there?
Yeah, it really is. And it's also one of those things, and I think running is a prime example, because again, for myself, probably one of my least favourite types of cardio. And it's easy to say to yourself, oh, I'm not a runner. Well, we can all run. We may not be very good at it. We may not be able to do it for very long, but we can all run, if we're, able-bodied. And the problem is we're not good when we start, and it's hard, and our body really reacts to it. And I think that feeling can so quickly put people off to start with. And also scary. I think some people get scared. People will often come to me and say, oh, my heart rate monitor, it told me my heart went to 120. Is that okay? And because people don't necessarily know what is a good range for our heart rate to get up to. And I think it's all these messages we tell ourselves, either things that we are or things that we're not, can so often prevent us from trying things. But there's pretty much nothing in the world we're good at until we've practiced. And sometimes it just takes a little bit of perseverance and trying, and perhaps support. I think that's why the Couch to 5K does so well, because actually it gives you that constant support, and it gives you that structure that you just have to follow along to. You've not got to figure out when to start and stop running, because I think if you don't have something like that, you just head out, you start running, you realise that after a couple of minutes you can't run anymore, and then you feel really disheartened, by it. And I think it's just about being a little bit more relaxed about it all, and realizing that you can do anything. It's just not going to be easy to start with. Yeah, nothing's ever easy to start with, is it? Running, exercise is the same, and we've all been in the position where it takes longer to get your running gear on than it does to actually go for the run, but we all have to start somewhere. Exactly. That's a great story. See, and then when everything's back to normal, you're going to be able to do that run on a Friday altogether. And do you find that you've got quite a nice GP practice, that everyone's quite up for the ideas that you come up with? Yeah, they're brilliant, actually. We are a very, very close team that, not everybody wants to do it, all of the crazy ideas I often have, but there's always a handful who will be championing us from the background. Some of us did the moonwalk, and one of the nurses made bras for us all. Other people was fundraising. 4 or 5 of us went on the walk. So we all have our own little niche that we do. But everybody who I work with, we genuinely are like a little work family. That's lovely. I guess you all get so much from that as well. That's for your own well-being, isn't it? That support that you have for each other must really help in what is, I'm sure, day in, day out, a very challenging job. Yeah, I think every single person in the practice has such a huge role to play, and a stressful job at times. And I think having that boost and that staff morale, and where we can all interact and bounce off each other, just helps everybody. The smooth running of the practice that the patients will pick up on, but also for our own well-being, and just making sure that we know how to de-stress and look after each other. And it's a bit of a big one, this next question, and you can answer it in the context of life or work, or a bit of both. What inspires you? Oh, I'm not sure. I get my inspiration from people, definitely people, not just family and friends. It's every source of information that comes. Sometimes I'll see something
on the news or social media, or it'll be somebody just making a comment to me in the street that inspires me. So I suppose the only way I can answer that is it's people, and all it takes to inspire me is a comment or somebody to say that they've struggled with something, or they found something hard, or this helped them overcome a challenge. That's all it takes. My mind is always going and always active. I don't know if everybody's is, but at night time I often get all of these ideas bouncing off from things that I've heard or come across in the day, and ideas form. So people, in short, I think it's just people.
It's a great answer. I completely get it as well. It's true, because it's through our communication and words we say to each other and things that we see that can completely alter the direction we go without even realizing it's happening sometimes. And yeah, I'm sure it happens with you, particularly with your podcast now, because you can go down many different routes with that. Do you have a vision for the future for that? Are there things that you really want to cover with it?
Yeah, I think I want to do quite a few series. The first one, I'm looking at cancer, and the reason I'm starting with cancer and launched the podcast during COVID is because I don't want people to be scared to pick up the phone to talk to medical professionals, and I want people to be aware of what the big red flags are that they should be really picking up on or spotting themselves. But then I want to move on to, I think, mental health conditions next, purely because I think we over-medicate and we over-diagnose a lot of mental health conditions, and I think it's trying to separate what actually is normal behaviour and responses to the world and the environment around us, and tease that out. And then chronic conditions like IBD and diabetes, and yeah, there's a whole, I could see it going on forever. There's so much that I want to cover, but I think I need to section it into different conditions.
I can see that, because also people then will know which series to start with. Once you're a few series in, it's like, oh, that's the bit we need to start with, and then you can work your way through the rest. And
yeah,
again, I guess it's that evidence of having the knowledge to see the symptoms that you should be paying attention to and not ignoring, compared to Googling things and getting carried away. Because I think there's a lot of misconceptions, and I guess people are very split. Some people are quite level-headed and will not dig too far into things, which is probably better on most of those sorts of problems, just because you could literally list off 100 issues when it comes to certain symptoms, which I think doesn't help, because then you get more stressed about everything. So I think it's really powerful to simplify it. And I read it in your introduction. In fact, you want to strip medicine back to basics. And I think that's just wonderful, because speaking in talk that everyone can understand is the best way to communicate with most people. And if most people are communicated well with, they're going to come to you for the reasons they really need to. And I guess it makes, not only does it make your life easier, it reassures the public when they need to worry and when they don't need to worry.
Yeah, I think there's a huge thing to do with communication in particularly medicine, but I guess any professional field where historically there's been that hierarchy or that power play. And I think that's completely wrong, especially when it comes to your health. We want people to be well and people to be healthy. And if people aren't getting the message on how they can be healthy and when they can identify when they're not, I think we've missed a massive reason why we went into medicine, or actually what medicine's all about. So that's where I'm trying to break it down. I want absolutely everybody to be able to go to the doctor, say what the problem was, and hear in simple terms what the answer is, or what they can do, or what the diagnosis is, what the management or treatment plan is, and not go away from it thinking, I don't know what happened, I have no idea what that was all about, but I'll just take this little white pill and hope for the best.
Yeah, or going home feeling like you need to Google it.
Yeah, and then coming out with all sorts of things. Yeah.
Again, the whole rabbit hole.
Yeah.
I mean, I guess it would be useful to leave my audience with the concept of, if they are experiencing symptoms, whatever they might be, do you think the first port of call should be the NHS website rather than Google? I'm going to say the NHS website, because I guess that controls the rabbit hole a little bit, and then as to whether we should be getting in touch with our GPs.
Yeah, I definitely think if people are worried, NHS website, and then pop into the search engine in there, because I want people to get reliable information and accurate information. And the NHS website, it's not perfect and it's fairly basic, but what it is very good at doing is telling you actually that symptom that you've put in needs looked at and needs investigated. Don't, go off onto Google or your forum or Facebook or whatever and try and treat that yourself. Get that checked before doing anything else. Or the exact opposite, that is absolutely nothing to worry about. These are the simple measures you can take. The pharmacy can help you, but do not worry. It's quite good at that too.
That's great. At least that gives direction, because sometimes you can just feel a little bit lost when you do have symptoms. And it's also interesting because I think I'm going to come to stomach issues, because obviously it's something that I have experience with. And there are so many types of conditions linked with stomach issues, and they can come from something as, obviously you can have an upset tummy, or you can have IBS or IBD or cancer. There are a lot of symptoms that cross over across very different treatment plans, I guess, and it's difficult for some people to come to the doctor and necessarily give the appropriate background as to what they've been experienced in order for you to be able to take the best path, because I would imagine it's one of those issues that has gone up quite a lot more people coming to you with stomach issues perhaps than in the past, or perhaps it's just people talking about it. I don't know. That's kind of the general feeling I get, that more and more people are getting diagnosed with IBS and the like. And is it easy for those things to get confused? And at what point do you, as a member of the general public, need to take a stand and feel like it's not necessarily the lower end, it feels like it's more of a problem? Because obviously it's difficult. That's a very difficult line when I know that a lot of these symptoms cross over as to what route the GP is going to take. And obviously different GPs take different standpoints on it. Like, when do you think we need to put our foot down? Seems a bit strong, but you know what I mean, really feel like we make our mark that something really isn't right, and it's not necessarily as easily explained as IBS, for example.
Yeah, that's a really, really good question. And you're right, a lot of tummy issues are rising. I think for me, the key word is persistence, and it's not the patient being persistent, it's about persistent symptoms. So I don't necessarily, unless somebody is in agonizing pain with their tummy, I don't want somebody to come and see me if they've had diarrhea for 2 days or for 5 days, because if you've had diarrhea for 2 or 5 days, it could well be a tummy upset. You might have eaten something, whether you know it or not. It might just be something that's not agreed with you. So I think a lot of people are getting symptoms for a very short period of time, and they're coming through our doors, and actually it's not particularly helpful to us at that stage, because we're not going to start any investigations if the symptoms aren't persistent, and that means 3 or 4 weeks in duration. So my advice, and this is assuming people are well, obviously if you've got a temperature, you're sweating, you're doubled up in pain, this doesn't apply to you. But if you're well, then it is worth just keeping a food diary and working out what you eat. Is the diarrhea associated with that? Are you getting stomach bloating when you eat different foods? What are your stools doing? What's your toilet habit doing? Is it changing based on what you're eating? And just trying to work out a pattern yourself. Has all of this changed since you went on holiday? Has it all changed since you moved house, or you have a different water source? There are loads of things that I'd like people to try and think about themselves, and go to the chemist and, get Gaviscon if you've got indigestion with it. Take peppermint oil capsules if you're bloated. Just give it a go for 2, 3, 4 weeks, keep the diary, and then come and see the doctor, but not within 24 hours.
I think diaries give you real perspective as well, because it's when you don't feel very well, it can feel like it's gone on forever, and it could only be a week. And on the flip side of that, you could actually have been suffering with the symptoms for weeks and weeks, if not months, and you kind of just gotten on with things and you haven't realized how much time has passed. So I definitely agree that it's a really helpful way of just giving that perspective, and also giving you a lot more information. If someone's taken a proper diary, and I used to keep it for a few years after I was diagnosed, because it gives you an idea of what's going on, and you can see the variations, how long it's been going on for, what exactly has been changing. And then if you've got all that information, you can make a far better diagnosis and which direction it needs to take in. So it's empowering not only the individual but also the doctors.
Absolutely. If you've got a 10-minute appointment and you've got a patient who comes in and says, I've got diarrhea, and you say, how long? Oh, I'm not quite sure, doctor. Is it related to anything you eat? I don't know. I don't think so. Is there any blood in it? Maybe once. When was that? I'm not sure. It's all very vague, and it's quite hard for us to actually gauge exactly what's going on. And the 10 minutes is very quickly lost trying to really nail down the symptoms when they started and what exactly they are. Whereas if a diary is brought to us, that cuts all of it out. We look through the diary, we ask about, the key bits that might not be there, about weight loss and about blood and levels of pain. And then we move on quickly to trying to find a plan, or at least get blood tests and poo samples off for your tummy, rather than, why don't you come back in 4 weeks with a food diary? It just makes everything so much smoother.
And do you think that's one of the best ways of reassuring people, if it is a sort of cloudy area, to do things like stool samples and blood samples? Is it something you do a standard, or are you kind of advised against it and only do it if you really, really need to?
So again, it would come back to that persistence of symptoms. I think if somebody came to see me and said, I'm in tune with my body, this is what's normal for me, and that normal has significantly changed in the last 4 weeks, this is what's been happening, I would investigate at that point. I wouldn't leave it, because actually getting a stool sample, getting some blood tests off, they're not particularly invasive. I don't think after 4 weeks of symptoms they're over investigating, but they might just catch an inflammatory bowel disease diagnosis, a cancer diagnosis, or put your mind at ease that actually you can go down on a dietary change and review again in 4 or 5 weeks' time.
Yeah. And is it, things, there are obviously age caps, I suppose, that certain things start getting checked for, cervical cancer and bowel cancer and things like that. Is that to say that GPs will avoid giving tests to people younger if they feel like that there is a high probability of them having it? Or is it one of those things that if you see the symptoms there, you go for it anyway because you'd rather have the black and white answers?
So for me, I do not want to miss a bowel cancer diagnosis in a 20-year-old. And my last podcast was about a 27-year-old who'd been to the GP 20 odd times and wasn't investigated, and was missed for getting on for 2 years of a quite significant tumour. I don't want to be that GP. I don't want to over investigate patients either. So I think there is a fine line. But for me, you hit that 4 week mark and you've had diarrhea for 4 weeks that's unusual for you, I'll be doing some tests to make sure you aren't that 1 in 100,000 person that I spoke to last time.
And I really want to ask you now, because I know there's the flip side of this, because I'm very much coming at it from with people that have symptoms that potentially have issues. But I am sure that a lot of people you deal with, or maybe not a lot, but some, I'll use the word hypochondriac, not necessarily coming to you for any particular reason, or not a good enough reason that should be taking a slot for you. Is it a big problem?
Yes. Yeah. There's a certain number of patients who, when you see their name come up, you can have a look how many appointments they've had in the last 12 months. And some patients are having in excess of 70, 80 appointments a year. And it's for the same thing. They've been investigated and they're either not accepting or taking the advice, or their mind's playing tricks on them and they're scared. But yeah, there are a lot of health anxieties, and I think it's on the increase.
Yeah, and probably will increase more so after this period of time. And do you think there's perhaps, and I know always comes funding is a problem, but do you think there's perhaps a small arm, a branch of the NHS that needs to almost be there to help these people? Do you think a lot of these people need someone to talk to reassure, almost counselling rather than a GP, but you happen to be the person they go to for the reassurance?
I have patients who fall into that category who either have tried counselling or have refused counselling and they still keep coming back. I think those people who have health anxieties want to see a doctor, they want to see that health professional because they don't think it's psychological or psychosomatic. They genuinely think that they have a physical problem and nobody else can help with that. It's a tricky one.
It is. I wanted to ask you, do you think there is any particular approach to solve that problem?
It has to be continuity. You have to have the same person saying the same doctor over and over again, because you're reiterating the same message to them, and they build up some degree of trust in you to the point that they will at some point accept what you're saying until the next symptom comes. So I don't really think there is an answer to that, and I think you actually have to recognise that these people are in a tricky place inside their heads, and they are going to have to keep coming. And I don't think there is any other alternative to that.
I guess it's part of being a GP.
It's part of being a GP, and at some point, if you're not careful, you'll miss something on those patients. Because if they come for the 60th time with the same symptom, it might be something slightly different.
It's a true test of patience, because you're absolutely right. You never know that moment when it might flip and, as you say, be a real thing. And but they're still acting exactly the same way as they have every time it's not been a thing. And there are so many challenges that you face as a GP. You can see how difficult a job you have and how little patience I think the public have with you, because they don't have to deal with it day in, day out, and having person after person, and it's a draining thing to have to do. On one side it's wonderful because you get to help people, and I suppose on that side, by talking to the hypochondriac type patient, you are helping them, because in some way you're reassuring them for another week or two before they come back again. But if they didn't get to see you, they'll probably get themselves into quite a state.
Yeah. So sometimes you have to draw up what's called a contract with a patient and say, every 2 weeks I will see you for a double appointment, but unless it's a dire emergency, and these are the things which constitute a dire emergency, we don't expect you to make any contact with us in between times. And if you draw up that contract, it really, really helps some of these people. They know they've got a fixed time with the doctor they want to see, and that's their time. And they're very, very respectful of that, and actually quite grateful to have the opportunity, and that would reduce the times in between people coming. That's
really interesting, and it does make sense. And ultimately, you're helping all of these people, just in different ways.
Yeah.
And would you encourage people? And this is a difficult one because I know what waiting lists there are. But would you encourage people? And I would personally specify men, because I believe they are worse at coming to doctors than women generally, just because they lose contact with their doctor, whereas women usually have more regular reasons to go to the doctors for a checkup every some sort of stipulated time, every couple of years, every 5 years. Do you think it's important to keep a relationship open even if you aren't necessarily unwell?
As the NHS currently stands, there isn't any funding for that. So if people come in and say, I want an MOT, then actually, unless they're invited for one at 40 or at different age times, there's no funding on the NHS for an MOT. It has to be done privately. So that automatically will rule out a huge chunk of the population. But I genuinely don't think there's any benefit in having a health check if you're looking after yourself and you have no symptoms. I think that probably is more likely to fuel some health anxieties. And if you look at statistics, 5% of all people who have a test done will be what's called an outlier and will have an abnormal result just based on statistics. And if you're that person, you go then down numerous investigations that aren't needed.
Oh, that's interesting. That was not the answer I was expecting. And do you think, I'm going to come back just briefly to the point of people not coming to the GP. So for people that do have symptoms but are choosing to ignore them, however serious they may be, but they do have things that they are putting up with or struggling with or dealing with for long periods of time, how long before you think that they should go, even if they're dealing with it? Just because you're coping with something doesn't mean there's not an underlying problem. How long do you think that should be put up with before you force yourself to make a doctor's appointment?
It depends on the symptoms, really, doesn't it? So if it comes under my red flag symptoms, then it would be 4 weeks. And there's a huge list of red flag symptoms. And one example is a change in bowel habit for more than 4 weeks, or a headache that wakes you from sleep or makes you vomit. So there are a lot of red flag symptoms. But if it's just, I don't know, an earache or a pain in your big toe, then actually you might be better firstly going to the NHS website and trying to help yourself. But we do things called e-consults, which are electronic consultations where you can send an email to your doctor. Might be worth just jotting down your worries and saying, I'm not desperately worried about these, but they've been going on for a long time. Are you worried? Is there something that you think we should be doing? And then we can email back and say, actually, the first 4 of your 10 questions, absolutely fine. Go away and, try olive oil for your wax in your ear or paracetamol. But actually, number 6 is a bit of a worry. Get some blood tests done and come and see us with the results. So emails are good, email consultations.
That's a great idea. And it's also for people that are less keen to walk through the door. It's a soft entrance, isn't it? It's a soft, or I don't want to waste the GP's time. I'm not really sure of this problem. I've managed to get on with it for a while, but then you can give that reassurance actually as to whether you want to see someone or not, because you obviously have all the experience of knowing all of those red flags that you need to pay attention to. Whereas again, the general public, it's just your own issues, isn't it, that you manage. Yeah. So that's a really good tip actually, and a wonder of modern technology that we can do that.
I know. And you can send photos. I've got this rash, please see attached photos. What do you think that might be? So it is brilliant.
That's a great idea for things like rashes, because also it stops them bringing it into the practice.
Yeah, I don't want an infectious rash sat in the waiting room with all our vulnerable patients. So I think it's another learning point from COVID that we are asking for more rashes and doing more video consultations so we can see people face to face if need be, but not in person.
Yeah, makes great sense. Let's hope it continues from here. So I would like to finish off by giving you the floor to share one thing that you think everyone would benefit from knowing.
Wow. I wish I knew this question was coming.
Take your time, there's no rush.
It has to come back to knowing yourself. It has to come back to you know your body best. And if you think something's wrong, something is almost inevitably wrong. That would be my pearl of wisdom, I think. You know yourself, and if something is not right, even if you don't know what it is and can't put your finger on it, get yourself checked.
A wonderful sentiment to finish the show off. So thank you very much.
You're welcome.
and thank you so much for your time today. It has been such a fascinating conversation. I have no doubt that people are going to love this one, and I'm sure they will head over to find you. Whereabouts can we find you on the internet? I will pop it all on the show notes afterwards.
Oh, thank you. Oh, it's been amazing chatting to you as well. Thank you. So my podcast is called Naked Health, and I'm on Instagram as Naked Health 1 because somebody else had taken Naked Health. And on my Instagram handle, then there's a link to my website where I've got a blog and you can listen to my podcast as well. So thank you.
And if we are in the south of England, we will keep an eye out for you on South Today.
Do. Yes, thank you.
Thank you so much.
Not at all. Thank you.
Thank you so much for listening to episode 14 of the LiveFitNow podcast. Dr. Penny Ward was a fantastic guest and we covered so many subjects. I hope you found it interesting. Don't forget you can pop over to the show notes to get in touch with us if you have any questions or feedback. We would love to hear from you. Thanks for taking the time to listen. Please do rate and review, and don't forget that you can share the podcast on social media with your friends and family. Thanks again. Until the next time.